Hello, my name is Nathan Basine. Today I'm going to be giving my reflection on what I learned in this HCIN 630 course, how I grew, and give an example of some of the projects and assignments we had. Um, Overall, I do feel like I gained a lot from this course, and yeah. So what I learned and how I have grown. Um, so basically, before starting this course, I never analyzed any legal case related to medicine in such great depth. Uh, it was great that this case was used as an example as I got into the details of how a electronic health record that was not designed well, how it can have serious consequences. It kind of brought together everything that I learned so far in this program because it showed the importance of having a working electronic health record and also highlighted the importance of things like being detail oriented um, and alert uh, when creating electronic health records. So basically, in this course, we really analyzed the Lowe versus Cerner legal case. This case involved a major flaw in healthcare delivery related to electronic health record design, clinical workflows, and patient safety. Um, so to break down the case, so basically, Michael Taylor was a patient who had sleep apnea, and after he got surgery, this required him to have continuous oxygen monitoring. His physician ordered pulse oximetry, but due to a hidden default in the Cerner EHR, the start time was set for 10 a.m. the next day instead of immediately. The system also allowed approval of orders without displaying every detail, without there being a double check with the system. As a result, oxygen levels for Michael Taylor were not monitored overnight, leading to severe and irreversible brain damage. So, like I mentioned, this case is about a patient named Michael Taylor. He suffered severe irreversible brain damage at Virginia Hospital Center. His grandmother, Ruby Lowe, filed the lawsuit against Cerner. Um, so yeah, this really highlighted some big defects in the EHR. There was a poor EHR interface design, hidden system defaults overriding physician orders. The staff could have been better trained on how to use the EHR, so this didn't happen. Also, the workflow could have been improved. So there was a lot of things that could have been done differently that could have prevented Michael Taylor from having such negative health outcomes. So, like I mentioned, Cerner Corporation were the individuals, or the company that created the EHR for the Virginia Hospital Center. And obviously, like I mentioned, there were some major defects in the software, and they are the ones getting sued. So right here, I have my cause and effect diagram that I submitted earlier in this course. I really learned a lot with this assignment. Um, Basically breaking down the case into different sections like people, environment, materials, methods, and equipment really helped me understand the case better, understand the different players at hand, how the issue occurred, and hopefully one day I can use this information if I work in the healthcare industry to potentially prevent something like this from ever happening on my watch. And I just learned so much with this assignment. So with the people section, I had to break down the physicians, the staff, Michael A. Taylor, and his grandmother Lowe. Uh, and there's a material section. That's where I talked about the confusing structure in the EHR software. Method sections, I mentioned we need a better workflow using the EHR. Environment was obviously Virginia Hospital Center. Then equipment, the Cerner software. So yeah, this assignment really showed the causes and the effects of what occurred at the hospital. So one of our assignments was the cause and effect diagram, which, like I mentioned, I learned a lot, and I felt like it really helped me understand the case. Then after that, we had the five whys, which broke down the root cause of the problem. I'm about to get into the one I completed. So this is my five whys assignment. So basically, I never really did this before, so I just read what it said. It started with event, what happened, define the problem as an event. So basically, I defined it as patient Michael A. Taylor suffered severe brain damage as a result of not receiving continuous pulse oximetry monitoring after surgery. Then it asked for a pattern, what's been happening. Define the problem as a pattern by selecting a poor performance factor. So basically, I wrote here, it shows that there are weaknesses in the EHR that the Virginia Hospital Center uses. The software had defects which cause alteration of start time for monitoring. Then for the whys, why is it happening? That's where you kind of start at one why and you say, why is that happening? Why is that happening? Why is that happening? Till you get to the root of the issue. Um, Basically, at the end, it asks the action. So this is where I said different recommendations I had. One of these things being the hospital needs to realize that they cannot always trust an EHR, even if they feel they can. Yeah. So after the five whys, we did a flowchart diagram. This assignment was pretty helpful for me for understanding the case, not only because we had to see what exactly happened, but we had to decide um, where there were decision points where the outcome could have been prevented. So um, this is my flowchart about the case. Starts on the left-hand side where the surgery was performed on patient. The first box says patient identified as high risk due to sleep apnea. Then next box, the doctor decides on continuous pulse oximetry. The order is entered into Cerner software. This diamond shape right here, um, it represents a decision point. So basically, at this point, does the staff confirm that the order in the software reflects a true intended start time for pulse oximetry? Um, so basically, if the answer is no, the patient, like what happened, they would suffer severe brain damage. If the answer was yes, then the physician will review the full order summary, including the timing. And then another decision point is, did the physician review all order details were correct before signing? If the answer is no, again, it will lead to the outcome of patient suffer severe brain damage. Next is continuous. If the answer was yes and the continuous monitoring was implemented, the next decision point is, were oxygen levels monitored overnight? If they were, the patient was stable. If they're not, the patient will suffer severe brain damage. So basically, there were many points, well, 3 points where there were critical decisions made. If the right decision was made at those points, the outcome could have been prevented. At this point in the course, I felt I gained a lot of knowledge of the cause and how the medical error occurred. And I just began to start formulating ideas of how the workflow can be improved so that it does not occur again. And like I mentioned, I do work in the healthcare field in the future. This is just great knowledge to have to keep in mind when doing any work in the future. So, and honestly, I feel as though I was able to learn the value of having an EHR system which you can trust and that is reliable. If that is not the case, terrible outcomes can occur, as we saw with Michael A. Taylor. So yeah, the goal should be to, as a healthcare provider, to make sure something like that never occurs and that the patient is safe. Thank you.